Good morning everyone, good morning sir. This is my breaking news. The National Situation PDEA 2017 Annual Report. The Philippines remains to be a country that produces and consumes illegal drugs. Illegal drugs proliferate in the Philippines market because of the huge number of drug dependents who patronize not only one but several types of illegal drugs, or otherwise called holy drugs. As of now, new emerging drugs are identified to have entered the country. These include new psychoactive substances and UNODC watch in the Philippines. However, there are NPS that are already classified as dangerous drug orders with DDB regulations Salvia Divinarum benzyl piperazine, ketamine, and alpha pyrrolidinopen chopinol. Ang plaka, people who suffered from addiction to illegal drugs more often than not push them to their personal and professional life. In fact, illegal drugs trafficking is the most prevalent and pervasive illegal drug activity in the Philippines. It includes the transportation and dangerous drug in control, precursors, and essential chemical manufacture, distribution, use of illegal drugs. Drugs are substances that change a person's mental or physical state. They can affect the way your brain works, how you feel and behave, your understanding, and your senses. This makes them unpredictable and dangerous, especially for young people. The effects of drugs are different for each person and drug. Drug abuse. Drug abuse is when you see illegal or illegal substances in ways you shouldn't. You might take more than the regular dose or pills, or use someone else's prescription. You may abuse drugs to feel good, ease stress, or avoid. Drug dependency. Physical addiction appears to occur when repeated use of drug changes the way your brain feels pleasure. To addicting drug causes physical changes to some nerve cell. Neurons in your brain. Neurons use chemical called neurotransmitter to communicate. These changes can remain long after you stop using the drug. Addiction. Puberty. Substance abuse is sometimes popularly believed to be more prevalent among financially disadvantaged population. Trauma is a strong risk factor for addiction, peer pressure, and undiagnosed mental health disorder.
Commonly abused drugs and the effects of substance-related abuse. Alcohol abuse is a popular problem affecting the resource and consequences, social problems, and both. However, alcohol depends on or alcoholism refers to a disease that characterized by abnormal alcohol-seeking behavior that leads to impaired control of effects. Short-term effects of alcohol use include distorted vision, hearing, and communication, impaired judgment, altered perceptions and limitations, bad breathing, long-term effect of heavy alcohol use include long-term effects of heavy alcohol use include loss of appetite, vitamin deficiency, stomach ailments. Long-term effects of heavy alcohol use include loss of appetite, vitamin deficiencies, stomach ailments, skin problems, sexual impotence, liver damage, heart and central nervous system damage, memory loss. Sapepin is stimulating drug, chemically related to amphetamine but with stronger effects on the central nervous system. Its treatment for drug includes speed, meth, and crack. Methamphetamine is used in pill form or in powder form by snorting or injecting crystallized methamphetamine known as ice, crystal, or glass. This is smokable and powerful form of the drug. Effects of methamphetamine use include euphoria, increased heart rate and blood pressure. Increased effects of methamphetamine use include illusion of limitless power and energy that leave the user feeling depressed, edgy, and craving more. Crack is a smokable form of cocaine that has been chemically altered. Cocaine and crack are highly addictive. This addiction can erode physical and mental health and can become so strong that these drugs dominate all aspects of an addict's lives. Physical risk associated with using any amount of cocaine and crack: increase in blood pressure, heart rate, breathing rate, body temperature, heart attacks, stroke, and respiratory failure, hepatitis or AIDS from the shared needles, brain seizures, reductions of the body ability to resist and combat infections, psychological risk, violent, erratic, or paranoid behaviors, hallucinations, and coke tongues, a sensation of imaginary insects crawling over the skin, confusion, anxiety, and depression, loss of interest in food or sex. Cocaine causes losing touch with real life, loss of interest in friends, family, sports, hobbies, and other activities. Some users spend hundreds or thousands of money on cocaine and crack each week and will do anything to support their habit, may turn to drug selling, prostitution, or other enemies. Cocaine and crack addicts often become unable to function sexually. Even first-time users may experience seizure or heart attacks which can be fatal.
Commonly abused drugs and their effects, substance and method of use. Hallucinogens. Hallucinogenic drugs are substances that distort the perception of objectivity reality. The most well-known hallucinogens include benzyclidine, otherwise known as PCP, angel dust, love boat, lysergic acid diethylamide, commonly known as LSD or acid, mescaline and peyote, and psilocybin or magic mushrooms. Effects of hallucinogens. These are the physical risks associated with using hallucinogens: increased heart rate and blood pressure, sleeplessness and tremors, lack of muscular coordination, sparse, mangles and incoherent speech, decreased awareness of touch and pain that can result in self-inflicted injuries, convulsion, coma, and lung failure. While these are the psychological risks associated with using hallucinogens: a sense of distance and estrangement, depression, anxiety, and paranoia, violent behavior, confusion, suspicion, and loss of control, flashbacks, behavior similar to schizophrenic psychosis, catatonic syndrome, whereby user becomes mute, lethargic, disoriented, and makes meaningless, repetitive movements. Every reacts differently to hallucinogens. There's no way to predict if someone can avoid a bad trip. Cannabis sativa, or also known marijuana. Marijuana is the most widely used intellect drug in the United States and tends to be the first illegal drug in use. It can be either smoked or swallowed. Short-term effect of using marijuana: sleepiness, difficult keeping track of time, impaired or reduced short-term memory, reduced ability to perform tasks requiring concentration and coordination, increased heart rate, potential cardiac dangers for those with pre-existing heart disease, bloodshot eyes, dry mouth and throat, decreased social inhibitions, paranoid, hallucinations. And these are the long-term effects of using marijuana: enhanced cancer risk, decreased testosterone levels for men, also lower sperm counts and difficulty having children, increase in testosterone levels for women, also increase infertility, diminish or extinguish sexual pleasure, psychological dependence requiring more of the crack to get the same effect. The physical effect of marijuana used particularly or developing adolescents can be acute. Marijuana blocks the message going to your brain and alter your perceptions and emotions, visions, hearing, and coordinations. A recent study of 1,023 trauma patients admitted to shock trauma unit found the 1/3 had marijuana in their blood.
Good day, I'm Magdalena Moha. Welcome to Hospitality News. After knowing the basic about drugs, the national situation, today 2017 annual report, I will now discuss. It has been indicated that there are many effects of drug abuse. They can be classified into four. Let's start with number 1, psychological physical effects, which are divided into 3. Letter A represents systematic treatments are drug therapies that work throughout the whole of the body. They can be given as an injection, infusion, or oral medication. They include chemotherapy, hormonal treatment, targeted therapy, or immunotherapy. A. Cardiac heart pathology. Irregularity of heartbeat, elevated or lowered blood pressure, chest pain, convulsion, or death from cardiac arrest. A cardiac pathology diagnosis entails of a condition in which the heart or blood vessels are affected. B. Pulmonary lung illnesses. Pulmonary lung disease may be caused by infection by smoking tobacco or by breathing in secondhand tobacco smoke, radon asbestos, or other forms of air pollution. Pulmonary diseases include asthma, chronic obstructive pulmonary disease, pulmonary fibrosis, pneumonia, and lung cancer. C. Hepatic liver problems. Liver disease. Hepatic disease is any disease that negatively affects the normal, healthy performance of the liver. And D. Renal kidney diseases. Kidney disease, if your kidneys filter extra water and the waste of your blood and make urine. Kidney disease means your kidneys are made and filter blood the way of the sugar. You are greater risk for kidney disease if you have diabetes or high blood pressure. The next is letter B, represents the general health. The importance of maintaining your general health and well-being throughout your lifetime by incorporating exercise, diet, preventive health checks, sleep management, managing mental health issues, finding ways to relax and unwind are all important aspects of our health and well-being. And A. Malnutrition or weight loss. B. Infections. C. Accidents. D. Blood transmitted diseases. Lastly is letter C, that represents usage. A. Tolerance. The individual needs more drugs to achieve the same effect they did previously with a smaller amount. B. Dependence to substances becomes the central point to the individual's life and they can function properly without it. C. Withdrawal. This happens when the individual reduces or stops the substances used. D. Overdose. The level of excitation reaches a point where it begins to produce physical and or psychological harm they can relate to them. Next is number 2, that focuses on psychological and mental health. The drug abuser may experiencing change in perception such as auditory and visual hallucination. The example are this is when a person hears a sound of something or sees something but it's not really there because it's just imagination. Orientation, such as paranoid psychosis. The example are this is when we think a lot and we are confused about something that we often get confused. Tips to prevent this from happening: calm down, breath, and consider that being calm is your best defense. Psychosis is the type we will find it difficult to trust someone. Memory, such as the mental capacity or faculty of retaining and reviving facts, event, impression, or of recalling or recognizing previous experiences. The drug abuser may also experience judgments that may lead to suicide and stress, either heightening or weakening of emotions. Next is number 3, that focuses on economic effects. A. Employment loss. Individuals lose their effectivity and efficiency in the workplace. B. Academic difficulties for youth being unable to accomplish their course or can affect their performance at school and their grades. C. Financial problems. Addiction to substance requires more monetary resources since the individual is forced to consume more of the substance substances to get their fix. Lastly is number 4 that focuses on social effects. A conflictual, dysfunctional relationship, an individual under the influence of drugs creates tension and conflict with their family members and among their peers that can result in broken relationship and abandonment. And B. Violence of the chemicals and the abuse of substance can impair the mind to illegality and to act aggressively. They can be the individual act violently in social setting. C. Safety. An individual under the influence of drugs can put someone in dangerous circumstances and can be prone to accidents.
Some substance abusers can be classified according to the frequency of their substance use. Number 1 on this list is experimenters. Experimenters are people who abuse the drugs for experimental basis. Number 2 is occasional users. The occasional users abuse the drug occasionally whenever there are special occasions. They abuse the drug once or every 2 weeks to 2 times a week. Number 3, regular users. Regular users abuse the drug on a regular basis, approximately 3 to 4 times a week or every day or every other day. Number 4 is drug dependence. Drug dependence, people who tend to abuse the drugs every day or almost every day, about 5 to 7 a week. Number 5, mentally chemical abusers, substance abuse, psychosis. Drug abusers who manifest signs and symptoms of the effects of drugs by hallucinations, disorientations, and what are the criteria for drug dependency? First is withdrawal symptoms. Second is need to take drugs to overcome withdrawal symptoms. Third is compulsion. Fourth is tolerance relapse. And the last is use social occupational act. How can you stay away from drug dependency? First is devote yourself to your studies and other productive activities at home or in school. Second is stay away from people, places, and events that promote drug use. Third is learn to manage feelings and cope with stress without using drugs. Fourth, develop a strong moral and spiritual foundation. Fifth is educate yourself about the effects of drug use. And last is always say no. What are the countermeasures for substance abuse? Abstainers and experimenters can be countered by preventive education, while occasional users, regular users, countered by counseling, and drug dependent is countered by drug rehabilitation, and mentally chemical abuser can countered by psychiatric treatment.
Comprehensive Dangerous Drug Act of 2002 or Republic Act 9165 is an act that supersedes RA 6425 or the Dangerous Drug Act of 1972. This amended law practices a more intensive approach against drugs abuse, trafficking, and enforcement. Comprehensive Dangerous Drug Act of 2002 Republic Number 9165, an act instituting the Comprehensive Dangerous Drug Act of 2002, repealing Republic Act Number 6425, otherwise known as the Dangerous Drugs Act of 1972 as amended, providing funds therefore and for other purposes. These are some of the important provisions in the law. Unlawful acts and penalties. An unlawful act is violation of legal laws, rules, and duties of societies. Number 9165. The penalty of life imprisonment to death and 500,000 to 10,000 million fines shall be imposed for the following acts: importation of dangerous drugs, dangerous drugs test and record requirement. Dangerous drugs means a narcotic drug, a controlled substance, or a controlled substance analog. Drugs are chemicals that affect a person in such a way to as bring about physiological, emotional, or behavioral change. Dangerous drugs are those that have high tendency or abuse and independency. This substance may be organic or systematic and pose harm those who use them. Participation of the family, student, teachers, and school authorities in the enforcement of the act. Participation of the family, student, teacher, and school authorities in the enforcement of the Comprehensive Dangerous Drug Act of 2002. The program is a community-based program of the preparing families to protect their members against the adverse effect of the drugs abuse. Program for treatment and rehabilitation for drug dependent. Rehabilitation, those that focus only on drug dependence. Rehabilitation, the process of helping a person who has suffered an illness or injuries restore lost skill and so regain maximum self-sufficiency. For example, rehabilitation work after a stroke may help the patient walk and speak clearly again. As drug abuse and addiction prevalent in young generation, it is imperative that the youth take part in its prevention and rehabilitation efforts. Number 1. Understand. Know the concept and reality of drug abuse. Number 2. Listen. Open yourself up in the knowledge of the experts and experience of the other that have undergone the abuse. Number 3. Share. Share your knowledge and network in aiding others toward being informed and recognizing their role in drug prevention. Number 4. Encourage. Give your peers and family members a good push in the right direction, whether it's prevention or rehabilitation. Number 5. Support. Take part in activities beneficial in the drug abuse prevention initiative. Number 6. Organize. Great minds think alike. And number 7. Inform. Approach government agency regarding incidents and cases of drug abuse.